Most ladies usually mistake yeast infection for bacterial infection because they feel any inching down there requires antibiotics. Good day everyone, and welcome back to Nurses Lecture Room YouTube channel. My name is Miss Mary, popularly known as a nurse with a difference, and I make learning easy and accessible for all my viewers. Today I'm going to be talking about yeast infection, what it is, what are the causes, who are at risk of going down with yeast infection, how to prevent yeast infection, and also I'm going to be talking about the signs and symptoms of yeast infection. But before we go into details in today's class, if you are new on our YouTube channel and these are content you are interested in, please click on the subscribe button, turn on that notification bell so you don't miss out. All my returning subscribers, this is Nurse Miss Mary saying thank you. Let's go there. Welcome back. Like I earlier said, today I'm going to be talking about yeast infection. Yeast infection is very popular, but sometimes we don't know as ladies we have yeast infection. What is this yeast infection? Yeast infection is a fungal infection that causes irritation, discharge, and intense inching of the vagina and the vulva. The vaginal and the vulva. Remember, the vulva and the vaginal are two different things entirely. I've explained it in our previous video. The vulva is more or less like the external genitalia, the external female reproductive organs, while the vagina is a hole, like it's inside, where the penis goes in and out, is what is the vagina. This yeast infection is also called vaginal candidiasis. Vaginal candidiasis. And it is said that out of three in four women, that's 3 in 4 women, will experience this yeast infection in their lifetime. There is something I want you to take note of, is the fact that yeast infection is not a sexually transmitted infection. It is not what? A sexually transmitted infection. So ladies who are not sexually active can go down with yeast infection. Because I see young ladies complaining, oh, Miss Mary, I am not sexually active. I don't sleep around. I don't have multiple sex partner, but yet I keep going down with inching. I keep going down with discharges. Miss Mary, what could be the cause? It could be yeast infection, because yeast infection is not sexually transmitted infection. So that takes me to the signs and symptoms of this yeast infection we keep hearing about. The first one I have to share with you is inching and irritation of the vaginal and the vulva. When there is an inching, you are always inching down there, there's always this irritation that can even lead to peelings around the vagina, the vulva, then that could be a sign that this individual might have yeast infection. That's one. Then the second one I have to share with you is a burning sensation, especially during urination. Whenever you want to pee, you find it difficult to pee because you're always feeling this burning sensation down there whenever you pee. That is also a sign. Then the third one I have to share with you is redness and swelling of the vagina. When there's redness down there as a result of frequent inching, there's swelling down there in such a way that the labia majora is not swollen. That is also a sign of yeast infection. Then the other one I have here is vaginal rash. There's rash around the vagina, white thick discharge, especially the cottage cheese discharge. The cottage cheese discharge is a sign of a yeast infection. Then the other one I have is watery vaginal discharge. Aside the cottage cheese, you can have the watery vaginal discharge. So these are the signs and symptoms of the yeast infection. Remember, one of the obvious signs is the cottage cheese discharge. That signifies this individual might have a yeast infection. And that takes us to the causes. The major cause is Candida albicans. The cause of yeast infection is the Candida albicans. Like I always tell you, as a woman, just know that the vagina has a good bacteria, which is known as the lactobacillus. It has a good bacteria. That bacteria is known as the lactobacillus. And also the vagina has fungi. It has fungus down there. Yeah, this fungi, this fungus down there, there are a mixture of different types. And albicans is part of it. What happens is that when there's an overgrowth, of the fungus, then we can say, oh, this person might be having yeast infection, there's an overgrowth, or this fungus has eaten it into the layers of the vagina, then this person can come down with the signs and symptoms of yeast infection. But basically, you as a woman has yeast down there, and you as a lady has bacteria down there. When there's an overgrowth of the bad bacteria against the good bacteria, then all these signs and symptoms can actually surface themselves and showcase themselves. So you may want to ask, who are at risk of going down with this yeast infection, or what put it in someone at risk, what can cause it? So the first one I have to share with you, antibiotics use. Yes, antibiotics use can increase your chances of getting yeast infection. If you are abusing antibiotics, you are taking antibiotics, that can alter the normal pH of the vagina, that can increase your fungus concentration, that can increase the number of fungi, that's the fungi around there, can increase the amount, and that might make you develop yeast infection. So if you know you are abusing antibiotics, I beg you, just try and stop it, because that might be the cause of the frequent itching you keep experiencing as a lady. Then the second one I have to share with you is pregnancy. Pregnancy can also cause yeast infection. Most ladies, when they are pregnant, they tend to go down with this yeast infection, and the doctors might give them some anti-fungi cream, such as your mycotin cream. Depends on what is available. Your doctor might give you some anti-fungi cream to help soothe that itching and also stop it. Then the other one I have is uncontrolled diabetes. If you have uncontrolled diabetes, you have higher chances of going down with yeast infection. Then also, if you are having impaired immunity, your immunity is not strong, you have weakened immunity, that is also a cause, could be a cause of yeast infection. Then the last one I have to share with you is oral contraceptive. If you are taking oral contraceptive, or you're taking some medications that increases your estrogen level as a lady, that might put you at a higher risk of going down with yeast infection. You may want to ask, how do I prevent yeast infection? Basically, in terms of prevention of yeast infection, the first thing I advise ladies is don't douche or douche. I've made a video on it. I've made a full video on it, so you can watch it. Douching is not good for you as a lady. It alters the normal pH of the vagina. Avoid very tight panties as a lady. Instead of putting on nylon panties, it's advisable you wear cotton pants, because cotton underwears help to improve the circulation down there. Then the third one I have to share with you is avoid using chemicals, scented soap around the vagina, because that can also alter the pH of the vagina. Then the fourth one I have to share with you is hot tubs. Avoid using hot tubs or very hot water to wash your body. Like there are some people that use boiling water. I think I'm part of those people, so I've reduced it. I like it hot because of the environment I am. Everywhere is really very cold, extremely cold, and I like my water, like the heater should be very, very hot. But generally, it can increase your chances of going down with yeast infection. And also unnecessary antibiotics use. I have talked about this antibiotics use because I've seen a lot of ladies using and abusing antibiotics back to back. So if you are using antibiotics unnecessarily, that increases your chances of going down with yeast infection. The last one I have to share with you is staying in wet clothes. Like you went for swimming, you're in that wet clothes. Staying in wet clothes for a very long period of time might increase your chances of going down with yeast infection. Just know that yeast infection is not sexually transmitted infection. That's one thing you should know. And also, yeast infection can be prevented with this your lifestyle living and what you do and what you put down there. So thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nosmes Mary saying thank you. Bye, and see you in our next video.